Hello everyone, welcome to Mpha 5P06. This week's topic will be looking at harm reduction. So my topic today will just go into the current opioid crisis from a harm reduction approach, which has obviously become a very popular topic right now. So I think this will be a good opportunity to speak to it and just help not only myself but all of us gain a better understanding of all of this. So with regards to the agenda for today's little video, so we'll just be going over what is harm reduction very briefly, how it's applicable to the current opioid crisis in terms of the opioid problem and its severity, research about current harm reduction methods in terms of controlling the opioid problem. With regards to the methods, we'll be talking about the benefits as well as the limitations to the current practices, as well as to understand how all of this research actually links back to policy and practice. And just to conclude, we'll be going over some of the gaps between research and policy and practice to see what has translated from research to practice and what still remains in terms of gaps. So firstly, I just want to go over what harm reduction is briefly. So just a relatively brief definition from the International Harm Reduction Association. Harm reduction is a concept that relates to policies and programs which attempt primarily to reduce the adverse health, social, and economic consequences of mood-altering substances to individual drug users, their families, and communities without requiring decrease in drug use. So this definition is generally a more broad one, and not to mention that it's also very applicable to the opioid crisis at this moment. And also notice that the end of that, it says without requiring the decrease of drug use. So remember that harm reduction is generally an approach where we're not trying to necessarily eliminate a behavior, but more so just to mitigate it. So that isn't the only way to define harm reduction, but any type of definition that you look at this point in time will generally tell you the same thing, that the main theme is that we're not after particularly eliminating a certain behavior or a certain attitude. It's just more so about reducing the associated harms with it. So in this case, we're obviously talking about drug use. With harm reduction, we're not about trying to, or rather we're not primarily concerned with stopping those from doing drugs, but just more so eliminating certain risks involved, such as needle sharing, that sort of line of thinking. And that this concept still acknowledges the fact that people are undertaking risky behaviors, but the purpose of harm reduction at this point in time is that it acts as a method to help keep the population safe, considering that as of right now we don't really have any other strategies or interventions that are effective enough at completely reducing or eliminating drug use and drug abuse. And that's important to remember that harm reduction, it's not a very new concept in that it's also used in other fields of health. So a very good example is through sexual health, where many of us in the public health field know that we can't stop people from having engaging in sexual intercourse, but the next best thing we could do is just to teach them about contraceptives. So with regards to the severity of opioids as of right now, you see on this graph right here that I found through Public Health Ontario's website that you can see how the numbers have changed since 2003 up until now, but not now, but in 2016, which are the most current numbers at this point in time. So you can notice how there are three distinct lines. The purple line obviously represents the number of emergency department visits. The more yellow and mustard line represents the number of hospitalizations, and you can also see the green line at the bottom, which just represents the number of deaths associated with opioid-related use. Generally, you can see that hospitalizations and deaths have been increasing a little bit, I would say, but the bigger concerns through the emergency department visits, where you can actually see from or rather look at the 2016 numbers, you can see that they're a lot higher, just under the 4,500 mark. And that if you look back from 2016 to 10 years before in 2006, you'll actually notice that the number of emergency department visits has actually doubled over that time. So that just really speaks to the severity of opioid use and overdoses. And then one final way to look at this is just through a more health equity perspective. So we look at the graph here. So it is stratified down to both sex as well as age group. And we can see that those from about the 25 to 64 age group are probably taking the brunt of the impact of opioid related deaths. And I think it's fair to say that there's a disproportionate number of deaths for those age groups compared to the 15 and 24 group, as well as the 65 plus age group. And if we actually look further into this graph, we can actually see how males have been experiencing more deaths compared to females. So it seems like if you're an adult to middle-aged adult and you're a male, it seems like you're probably the one experiencing the worst out of this. So not only are people experiencing overdoses and dying, that there's also a health equity element to this as well. So when we look at things from a opioid perspective with regards to harm reduction, the two most common interventions that are used in this type of approach include the use of needle exchange programs or just various kit programs that disseminate drug use equipment, and as well as through the implementation of use of safe injection sites. So both of these are probably the most common things used in this context from a harm reduction perspective, and that we'll just be going over both of these in detail. So needle exchange programs or other various kit programs are more so just concepts that provide drug users with clean needles in exchange for their used needles, and it's not just limited to needles alone. Some things that are provided include better equipment to prevent people from using things such as spoons, dirty containers, or filters, whatever may be the case, because using unsanitary equipment has the potential to actually spread various diseases and ailments. So some of the more common ones include the spread of HIV as well as hepatitis C, both of which can have detrimental impacts with regards to costs on the healthcare system. And that really, the use of needle exchange programs or just various kit programs are to help drug users that are unable or unwilling to stop using drugs. An example of a kit includes the provision of Narcan, or just commonly known as naloxone kits. So with these kits, you can actually see pictures of both of those at the bottom left. So with naloxone kits, they actually have the potential to actually reverse an opioid overdose. So if for whatever reason somebody overdoses, if these kits are used right away, the naloxone can actually help individuals breathe and regain consciousness. So with regards to naloxone kits, they can be administered either through injection or through a nasal spray. From my understanding, both of these are free, so there is no cost associated with this, as well as with needle exchange programs. Not to mention that both of these are obviously legal in Canada, and so obviously it's hopeful that the use of these methods can help lower any adverse effects associated with opioid or just drug use in general. So with regards to needle exchange programs, there are obviously various types. We have fixed sites, which are just general buildings where people can go to and drop off their used needles and get new ones. You also have mobile needle exchange programs where organizations will go around from area to area to give out free needles for those. So those are probably two of the more common methods used with regards to needle exchange programs. Obviously at the bottom you can see that home visits, satellite needle exchange programs, and Needle exchange programs through pharmacy are obviously all viable options as well, but just generally less used. So with regards to benefits and limitations of needle exchange programs or just kit programs, there's been some literature that has suggested that there have been less used syringes found in certain areas within the public. So one study from a spatial perspective assessed various neighborhoods around San Francisco and found that areas with needle exchange programs have generally less used syringes in public areas than areas that don't, which is extremely important because obviously if there are used syringes or needles around, it has the potential for people to use them, and it's not limited to just drug users. It could also be inclusive of even youth or kids who just curiously stumble upon the used needles and could potentially contract some sort of a disease or infection if handled inappropriately. There's also some literature that has suggested that needle exchange programs and kit programs have actually reduced incidence in HIV infections. So one systematic review found that in most cases, that the implementation of needle exchange programs or kit programs can actually save the government a lot more money than in cases where people would actually contract HIV, because since they would be more of a bigger burden to the healthcare system. And that depending on who you speak to, these programs are generally inexpensive to implement. So another piece of literature has actually found that the implementation of needle exchange programs specifically can cost anywhere between $23 to $71 per person annually. Not to mention that the use of needle exchange programs or kit programs can actually be combined with other health strategies. So a very common example is just through education, and it's through this, it's hopeful that any education or information or any resources that are obtained could help people be a little more cognizant of their drug use or potentially reduce or eliminate drug use, generally speaking. With regards to limitations, there's actually some inconsistency in the literature to support the needle exchange program's ability to reduce the transmission of hepatitis C. Obviously, that's not to say that it's not effective at reducing hepatitis C. It's just more so to say that more research needs to be done and more results need to be replicated before we can actually conclude anything definitively. And not to mention that other limitations include the lack of data in regards to needle exchange programs or naloxone kits. A good example is just something really basic, includes the actual uptake of these programs, and that some literature as well as some scholars have suggested that more program evaluations are probably a lot more appropriate at this time. A more common limitation includes the lack of public support, which is a very hot topic at this point because a lot of people misinterpret the purpose of these programs, where their perception is that they believe that the implementation of needle exchange programs or kit programs actually promote drug use, which obviously isn't the case because the goal here is just to mitigate the risk associated with it. So safe injection sites are also another form of harm reduction where individuals can go to a facility that offers very safe and sterile equipment to help them engage in their drug use. And that these facilities generally act as safe havens for drug users, so drug users can come and go, do whatever it is that they need to do without any legal sanctions placed against them. Generally, these sites are supervised by medical professionals, so they are available on standby if anything were to go wrong, such as an adverse reaction or it can just provide any type of education or information for those that engage in drug use. So this practice is a lot more common than Europe than it is in North America. So some common countries in Europe that have safe injection sites include places like Germany, Portugal, Sweden, or Italy, really just to name a few. And that it isn't really until now, or really the last year, where safe injection sites have garnered a lot more attention in North America. So again, very similar to the needle exchange and kit programs, this doesn't really act as a way to eliminate drug use, just really more so just to make it a lot more safe, if anything. And obviously very similar to needle exchanges, safe injection sites offer safe equipment for those to actually engage in drug-related activities. So common things include needles, filters, really just to name a few pieces of equipment. So this is really just more of a comparison of what a safe injection site would look like from the inside. So towards the left, you can see that the individuals are placed in their areas with very sterile and clean equipment. And on the right side, these are just a few snippets of a video that I also posted about injection sites. So what you see on the right are some of the typical environments that drug users would be in when they're engaging in drug use. So the video that I did post on Sakai actually deals with a safe injection site in Vancouver called Insight. So it actually is North America's first safe injection site, and it's actually been around for quite a while. So this, if I remember correctly, this site has been built in 2003 and is still operating to this day. And really, if you just look at the conditions from left and right, you can see that they're very night and day. One setting, it's a lot more clean, it's a lot more sterile, a lot more safe. And then on the right, you can see that that type of environment would just predispose people to reusing, or sharing dirty needles, which again have the potential to spread things spread things such as HIVs and hepatitis C, to really just name a few things. With regards to the benefits and limitations of safe injection sites, excuse me, that there is actually evidence to say that there's been decreases in the amount of overdoses that have occurred in public areas. There's also some evidence within some research that have actually suggested that deaths have been prevented as well. So one piece of literature has actually suggested that within a 4-year period, it's been approximated that anywhere between 8 up to 51 deaths have actually been averted with the implementation of safe injection sites, while other pieces of work have demonstrated more or less. Generally speaking, some have also argued that this is a more cost-effective approach, at least within the long term. So one study from St. Michael's Hospital in Toronto have actually suggested that if a safe injection site were to be placed in Toronto, within a 20-year span, it would probably cost around $33 million in terms of operating expenses. However, it's been estimated that about $42.7 million would actually be saved in terms of healthcare costs related to any contractions or treatment with regard to things such as HIV and hepatitis C infections, which are the most common infections associated with the use of very unsanitary equipment. So all in all, this represents actually a saving of just under $10 million. So with that said, it seems that an approach like this would not be beneficial in terms of reducing the amount of adverse outcomes, but also just advantageous from an economic perspective. And not to mention that some works of literature have also examined and have called to say that anywhere between 5 to 35 HIV infections could be avoided per year with the implementation of safe injection sites. With regards to limitations, there are logistical barriers involved, such as the actual placement of a safe injection site. So, some common things that have to be considered include whether or not, if whoever you're placing a site is actually going to reach the maximum amount of drug users, as well as considering what type of other external things could come up, such as opposition. So if you were to place a site for a neighborhood example, obviously the influence on the youth around there would be extremely questionable. Or if you were to place a site like this in more of a more busy area, such as, let's just say, a downtown area, there's some talk about how this would affect things such as tourism or economic prosperity. There's some other literature that have suggested that the implementation of safe injection sites haven't really demonstrated enough of a concrete decrease in crime, violence, or drug trafficking. And very consistent with needle exchanges and kit programs, there's also public fear and opposition where something like this could create an image or create some sort of false reality where the government is actually supporting drug use, which obviously isn't the case. And not to mention, very similar to needle injection sites, there's very uh, sparse findings in program evaluations. Not to say that they haven't been done, it's just more so some scholars are very skeptical that whatever has been done in terms of evaluations isn't enough, and really at this point, some have suggested that more need to be done. So when we look at things from a policy and practice perspective, with regards to needle exchange programs or kit programs such as the naloxone kits, there at this point there's been, generally speaking, full support from the government, where these programs are funded by the government. Granted, these programs have actually been around for quite a while, at least for needle exchange programs. So they've been around since the 1980s, or at least the concept has been around since then, where um, the first needle exchange program was actually done in Amsterdam, of all places, and not really until Canada until around 10 years after that. And even then, to this day in 2018, we're still seeing that there are various places around the world that are still just getting used to the concept of harm reduction overall, and that just recently, some places in the United States, such as Nashville, they're just getting their first needle exchange program as of now. And not to mention that these programs are actually a lot more common than safe injection sites. And um, with that said, that there's actually been more initiatives to actually expand needle exchange programs even more. So at least within the Canadian context, there's actually been a decision by the Liberal government to support the implementation of needle exchange programs in federal prisons. So from whatever research that we have at this point, it seems that on both Ontario and New Brunswick will actually be getting a needle exchange program, and that's actually hopeful that by implementing this, there's actually a goal to reduce any transmission of HIV or hepatitis C that actually may occur. So again, this is a very recent thing, at least with regards to federal prisons, so it'll be extremely interesting to actually see what type of research or at least program evaluations will actually come from this. So very similar to needle exchange programs, there's now full support from the government in terms of actual support to actually implement safe injection sites, as well as with funding, although granted the support for this has been a little more hesitant, if anything, considering that at this point in time there are more needle exchange programs than there are safe injection sites. And that really, the higher influx and desire for safe injection sites comes from the actual opioid crisis, which has occurred for the last couple of years now. So I would argue that the support for safe injection sites has actually come from a more reactionary perspective more than a proactive one. So very similar to needle exchange programs, the actual concept of safe injection sites has been around since the 1970s and 80s, again, which have originated in Europe, but is only making its way to North America now. And it wasn't really until in 2003 where Canada, specifically Vancouver, opened up a safe injection site, which would happen to be the first injection site opened in North America. So the name that you see right there, it's actually called Insight. But really, since then, there's been a lot more support and a desire, and you can actually see that now that there are multiple sites in BC and in Ontario and in places like Quebec and Alberta, where there are now initiatives to actually place more safe injection sites in Canada. So as of right now, that there are 17, with an additional 11 more that have actually been approved in Canada. So with regards from a policy perspective, there have been some other policies drafted around the world, so specifically within the United States with San Francisco and Philadelphia, where both of these areas have actually been working extremely hard onto developing a policy that will support the use of safe injection sites, but obviously with policy there are barriers that come along the way. Typically that the desire for such a policy to have safe injection sites has to go through multiple layers of government, and not only that, that there are also other external things such as opposition from various stakeholders. So for example, in Philadelphia, the police commissioner have actually made it extremely clear that they have no desire to really implement any safe injection sites. So this really just speaks to the practicalities of research and how this links to policy and practice. But from a more Canadian perspective, we look at Bill C-37. So this is inclusive of the Controlled Drugs and Substance Act. And really with this act, it's the act that actually controls the application process for communities or areas that wish to open their own safe injection site. So within the last year, Bill C-37 has actually undergone some changes to make the process of establishing a safe injection site a lot more simplistic and easier. And that really a big component of this is actually to include the community in the consultation process of actually implementing a safe injection site rather than keeping it a lot more internal. Some basic things from that include that decisions on applications for safe injection sites in Canada are going to will be made public, and if there is a refusal for a application, there will also be reasons as well as the public will actually be given information about the status of an application. And really, all in all, this is just done to make the process a lot more transparent, if anything. For any safe injection sites that require renewal, there's no longer a process to actually submit a new application. If anything, if a site needs to be renewed, it can just simply be done by contacting Health Canada. And that, not to mention that, again, we have to remember that the bill has now included more of a community approach. So at this point in time, the consultations will be made with various stakeholders within the community to discuss details such as a potential site location of a safe injection site, as well as to describe any health services that will be offered at those sites, as well as to give any additional site security information. So with regards to gaps, barriers, and potential future work, it can be concluded at this time that it's actually taken quite a long time to translate this research into policy and practice. So I mentioned that the creation of needle exchange programs as well as safe injection sites have actually been around for quite a while, since the 1980s to be exact, and that it isn't really until now where there's a lot more attention placed onto these programs, especially with safe injection sites, as now these initiatives are being pushed as a result of the current opioid crisis. Something that I've mentioned quite a bit in this presentation is that politics actually interfere with these initiatives. So of course, with the recent provincial elections, Doug Ford's PC government have actually expressed that they have absolutely no desire to really implement safe injection sites, where they believe that, like others, that a program such as this such as a safe injection site, will only just promote more drug use, when in reality that's not really the point of it. And that with these politics, there are also public opinions as well. So really at this point, there needs to be better methods to actually control and address public opinions or public concerns, which these things do exist. So there are various communication plans that exist within gray literature or within the academic literature. The PHO, for an example, has a plethora of plans to actually help public health units or different organizations actually establish effective communications plans to address any potential fear that exists within the public. And that at this point in time, some scholars have argued that there's some inconsistencies in both academic literature as well as program evaluations. So it seems that at this point in time, there's literature that suggests that both needle exchange programs or kit programs as well as safe injection sites are effective. Then some have suggested that there are some minor improvements or more marginal significant differences, or excuse me, marginal differences. And that overall, it's important to remember that the use of needle exchange programs as well as safe injection sites don't particularly address drug use in terms of actually eliminating it. It's just more so access to mitigate it. And not to mention surveillance data or just data collection in general needs to be improved. Some really basic things include measuring things such as how many naloxone kits are given, or any other similar metrics such as that, really just to help help public health as well as other organizations gather a better understanding of what's actually going on. So just some final conclusions about all of this. I think the progress from research in terms of its translation to policy and practice has been okay at this point in time. I think one of the bigger things to be concerned about is just how slow it's taken to actually implement this research into practice. So I mentioned that needle exchange programs and safe injection sites have been around, or at least the concept of those things have been around for a relatively long time, but it isn't really until now, especially with safe injection sites, where they're starting to garner a lot more attention, in terms of its implementation. And that really, the more external barriers associated with these harm reduction methods are associated with things such as politics. So obviously with the politics, you'll run into people that agree with the use of these programs and methods and people who don't agree with these methods. So that it really just becomes a power struggle at that point, and that really whomever is in charge sort of dictates the future plan moving forward. And that other barriers include sort of the logistics of actually establishing these programs so as to safe injection site, kind of where do you plant a site and how do you consider the different variables associated around it, things like reaching the most amount of people while addressing concerns related to exposure to youth or the potential effect that a safe injection site, for example, could have on the tourism industry, and really all of these lingering effects from an economic perspective. And that really establishing effective and efficient policy will actually be the key to determining how fast these methods can actually be established, because right now we do have evidence that suggests that there is some sort of effectiveness with needle exchange programs and safe injection sites. It just comes down to how well can policy be drafted up to actually support this. And really the key, in my opinion, is just to find common ground amongst politicians and stakeholders involved in this decision-making process. So this wraps up the presentation from me this week. So hopefully everyone was able to learn something, and if anything, any questions, I can be reached via email. And thank you for watching.